How long has your right knee been a problem?
Oh, I would say probably about 6 years.
6 years.
Yeah. You know, I just thought you're supposed to, play through the pain. But then it, became, of course, it escalated and that pretty much diminished my ability to be active. So my goal is to have both my knees corrected, and the left one is. I'm real happy about the left one. It's a miracle that medicine has developed new technology that we in our senior years now can remain active and have a high quality of life.
Absolutely.
I mean, when he told me I was going home the same day, I looked right back at the doctor and I went, "What? The same day?"
Yeah. There's so much to be said for the comfort of your own bed, your own routine, and like I said, I find people are just more active when they are in their own home.
This will make people feel comfortable, I think, in the future to know I went through it. Yes, you'll be out in a day, and especially if you're a good candidate and you do what the doctor says, and you're, you got to keep up with all the protocols. You'll be fine.
Right. Well, let's do this. If you don't mind, we'll take the walk through and just make sure that you've got
all the
space that you need and the equipment. And we'll
All
go from there.
right.
And this rug too. You don't want to catch the back legs of the walker. Do you remember the sequencing on the stairs? Up with the good, down with the bad? Okay.
I have the walker. See, the walker's right there.
Okay.
And this is the room, and then
Okay. Yeah, because you've got the seat
I
here.
sit
Okay.
here and swivel.
Okay. Yeah, then that actually probably will work. In terms of touring, that's pretty
That's
much
good?
it. Yeah, let me run through the checklist to see if we forgot anything.
Make sure.
Pain management, you'll have your medications that they give you. Some people take very little narcotics and are off them by about 3 weeks. Other people, it takes a little bit longer. And then, plan of care. The nurse will be here with the day you get home.
You'll do the PT, Yvonne will do the OT.
Yes.
Okay.
And you'll have 5 visits, so Tuesday through Saturday. And then 3 times a week for the next 2 weeks. Usually we see people about 3 weeks. Is there anything you can think of that we haven't covered? Any questions?
I think you've been very thorough, very wonderful. I'm in good hands.
You'll do well.
I'm in good hands.
You'll do well.
How's your morning going so far?
Great. I mean, I'm waiting to get the right one fixed, and we'll be all set, right, Kathy?
That's right.
We got this one good. We're gonna fix this one.
Okay.
Are you ready for me?
Yeah.
Okay.
This antibiotic takes an hour and a half to go in, to infuse. So they want that to be well on its way before you go into the operating room.
I get that,
Okay.
yeah.
So you said Anna's your physical
Oh
therapist?
gosh, she's wonderful.
Yeah, that's good.
Yeah, she's doing the
very good.
PT.
Yeah.
I don't know who the nurse is.
It's through North Shore, so I'll just call them
Find out.
when you're leaving.
Okay, great.
How you doing?
Hey, I'm doing great.
Yeah?
I'm glad to be here.
You ready?
We're gonna finish this. I'm ready.
Confirm for me which side so I can mark it.
The right.
The right knee is the correct knee. I'm gonna write the word yes here. Okay, any changes to your health since I talked to you last
No,
time?
I'm great.
Beautiful. Okay, so you know the drill. The anesthesia folks will be here shortly. We'll get you back there. And then our goal is to get you back here, moving ASAP, do a couple therapies, out you go home.
I go.
Okay?
Yay.
And then I'll be in touch with you. I'll call you later this evening to make sure you're doing
wonderful.
okay.
Okay.
All right?
I'm in.
The anesthetic will be tailored in a way that you can wake up quickly and recover quickly and go home today. And that's the plan, I understand, right?
Yes, thank you.
We will try to tailor the pain medications in a way that to give the least amount of narcotics.
Okay.
So narcotics is only one thing that causes nausea sometimes, and this way you can recover quicker and go
Oh,
home.
okay, great. Oh, wonderful.
Any questions for me?
No, I think you got it all.
Okay.
Good.
All right. So a couple more people will talk to you, and as soon as
Okay.
we're ready, we'll take you.
Wonderful.
We're ready when you are.
Okay.
Yeah,
Thanks.
Thank you.
So this is our customized plan that we've made for Denise, based on her preoperative x-rays as well as a preoperative MRI that we get. we build a 3D model of her knee on the computer ahead of time. These are actually custom printed molds of her knee just to show you how these work. Again, the way that goes is it just snaps right over the end and fits her knee perfectly. And all of the data that we put into how we want the knee to fit, where we want to make the cuts, all of that is built into this guide and to exactly where those holes are. Using this system allows us to do it more accurately, less invasively, and in a faster amount of time, so more efficiently. Okay, let's do our timeout. This is Denise Curran. We're doing the right total knee. I marked the right side. X-ray show right knee arthritis. Remember, the right knee.
Right knee, breathe.
Decision starting. By using those customized guides, we're also able to minimize our incision because we don't need to use big guides and instruments and jigs in order to do the operation or get our angles just right. This is a medicine that helps with pain control after surgery, so we inject it around the capsule of the knee. It should last for up to 72 hours, which again allows for her to recover very, very quickly with little to no pain. At this point, we're just opening up the final parts to put them in.
Size 4 right, 2028.
So now our tourniquet is down at 35 minutes. Our incision is relatively small, about that big. Like design, we'll check our final parts here again. That's the end of the operation. We're going to close the wound now. We'll see her back again in the recovery room.
We are. We're going to the recovery room now.
You feel me touching your toes?
Absolutely.
Okay, good. So Megan is going to be your physical therapist. I just talked to her and told her you were on your way back, so she was glad to hear that.
I feel great. Everyone was right there for me, offering me all kinds of goodies like crackers and ice chips. So I think all in all, I'm just really happy about how it went. I really am.
Okay, come on down again. Down with the surgical leg again. That's not going to change.
Okay.
Good. One more.
Got it.
A little bit is repetition process because I remembered it from the last time. It is really nice to have coaching. I mean, she was great.
It's about noon. Denise has already been up twice. Walking great. I saw her therapy notes and I saw a little bit of her walking in the hallway. Her therapists have cleared her to go home. This is a team effort, so we kind of were able to see the process even starting last week with her home health visit, coming into her getting here in the hospital, the great nurses that we have getting her ready to go to the operating room, our great anesthesia team. And the anesthesia protocol is very specialized to minimize the use of narcotics. Once we went to the operating room, as we talked about there, we executed the plan that we had conceived from her MRI and her x-rays and looking at her clinically weeks and months ago. Once she left the operating room, she was able to go to our rapid recovery area where our nurses were able to recover her quickly. But the take-home message is that Denise is going to go home today, number one, because she can, and number two, because she wants to, and number three, because she's comfortable enough to do so. And it takes a big team approach to make that happen. That surgery that we watched on its own doesn't result in this. It's all of us coming together. From the time I've seen her to her leaving the hospital is 6 hours, which is great. All in all, I think she's doing well. I'll see you back in the office in 3 weeks. She's been through this before. I don't anticipate any issues or problems.
Now,
Surgical first, right?
Yep. And then you're going to turn around and put your bottom down first.
Put the butt down.
You're a wonderful
so
patient.
wonderful.
You did great.
Thank you all.
Good luck to you.
Thank you.
Hi, good afternoon, Denise.
Oh,
Hi,
Sean,
my name is Sean.
right?
I'm the nurse from NorthShore
Thank
Home
you,
Health.
Sean.
Yeah, Dr. Bashal sent me to see you, since you just got home. The main thing, how's your pain level right now?
The most it's been is a 2, to be real honest with you. It's not really kicking in yet.
Wow. But you know what? Keep an eye on it. It's the best time to take your pain medication is before you go to bed and before you exercise. even you have zero pain. Especially when the physical therapy comes.
A half an hour before.
Half an hour to an hour. Okay, I'm gonna go over with your medication. Whatever listed here, that's what we're gonna follow, okay?
Yes. Voice checking for
blood clots.
Blood clots.
Blood. Yeah.
And this is fine?
Yeah, I went.
Okay. That's pretty good to pick up my knee like that.
Yeah. Wow. And you're able to wiggle.
Yeah, look.
Good.
Hello?
Hi, Denise. Dr. Pashon. Did all the home health folks showed up and everything's all set and tucked in?
Yes, I'm all done. The nurse was Sean, and he educated me about all my meds, and everything went really well today. I'm still feeling really great.
Awesome. Well, I expect that to continue. Let us know in the office if you need anything, and if there's any emergencies, you can let me know as well, okay?
Okay, doctor. Thank you so much. Well, right now I'm 4 weeks post the surgery, so I'm feeling that I'm just right on my path of being more ambulated, being more comfortable.
So I think having an active and motivated patient during the PT process after the surgery is critical and influences the outcomes. Outcomes include range of motion gains, returning back to activities, and overall quality of life.
What I'm looking forward to is in the next couple months planning a trip to Florida so I can play tennis again. And everything so far is just going great. I think it's much better to have your surgery and go home the same day, because the minute you're in your own environment, you're actually more motivated to start getting yourself ambulated. They had such excellent in-home services. They interjected their reassurance, their confidence, and how well I was doing on a daily basis. So it was a really good outcome for me. It was tough. It's tough. I mean, if my knees were normal, it would be a little tough.